Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jaime Hope, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. All right, welcome to another episode of Navigating Hope. I am very excited to be joined today by Lisa Schultz, who has a really fantastic background. You all know my passion for preventative medicine and health. She is a certified nutritionist, personal trainer, and founder of the Verdura Method. Did I say that correctly? Yes, good. I was practicing to help people overcome chronic pain and inflammation naturally. And there was a very specific incident in Lisa's life that kind of helped accelerate that. But let's take us back to the beginning. How did you get started in nutrition and wellness? What inspired you at the beginning?
I have always had something in me that loved being active and eating healthy. And I remember the very first book on nutrition I read was when I was 17 years old, even before I had a major in college. I was just interested in how food affected the body. And when I did go away to school, that's when I got really into going to the gym. And I made that connection pretty early on. This was back in 2002. So this was like around 20 something years ago that I realized exercise really affected my mood in a good way. And I had struggled with that as a kid with anxiety and some depression. And once I made that connection, I really tried to keep that up as I was going through my later teenage years and in college. And then soon I started reading books on nutrition and how that also connected with the body's mood and just my energy and everything. So as soon as I left school, I got certified immediately as a personal trainer and a nutrition coach. And I started my journey there. I did a private personal training studio right away. That was my first job. And my first job out of school was waking up and opening up the studio at 5 a.m. So I really had to be on top of my game there. But even then, I was still 22. I wasn't really healthy the way I am now. I was having Red Bulls and I wasn't drinking enough water. At 22, you can kind of do anything and get away with it, right? And so I started personal training and doing a little nutrition. And then I decided to launch a new business. This was back in 2007. And I saw this really niche idea to work on brides to be. And I launched this idea called the wedding trainer, this billion-dollar industry working with brides to be that'll spend countless amounts of money on looking their best on their wedding day. And so I really started, so I left the private clinic or private studio and I launched the wedding trainer in Chicago. And I started training brides to be. And I did that for about 3 years. It was very fun, very light, nothing very serious about it. And then a few years later, in 2011, I was in a car accident. I was walking across the street in Chicago where I lived, in a terrible intersection that everybody knows in the city. And I was following where I should cross, and someone just came barreling through the intersection and hit me while I was in the crosswalk. And that changed the trajectory of my life. Back then, I thought it was the worst thing that could have happened to me. And what I know now, being on the other side, is that it was actually the best thing. It made me so much better at my job. As you know, an ER doctor, it's a lot happens when you're going through that. That created its own level of trauma aside from being hit by a car. But once I was going through all of that and I got to the other side of my recovery, I saw this huge gap in wellness, which was there are people that aren't necessarily fully injured, but maybe they had to go to PT for some injury, right? Physical therapy, but they couldn't exactly go right back to the gym and do everything that they did before the injury. So I started to notice that there was just another opportunity for a very niche idea, which was to help people that had graduated from physical therapy but weren't quite fully ready to go. And it gave me this new idea to look at the body as one, a holistic view of not just working with someone's broken ankle, but how was their back affected by this? How are their shoulders and neck aligned? So everything was coming into play with that, in addition to how important the nutrition was. And once I started paying attention to everyone's nutrition and lowering the inflammation that way, it was this total kind of like a light bulb went off. Like, okay, we have to look at the whole body, a holistic view, 360. And with that, over time, I started to look more into everyone's stress and everyone's sleep and how are they getting rest and what are their social dynamics and are they giving themselves grace during the day to or in their life to be a more positive thinker. And I realized all of this had to do with everyone's healing. And that sort of led me, to this path where I came to LA with my husband and I worked at a physical therapy clinic and I told them, you should hire me as your wellness director. We're going to not just do physical therapy. We're going to look at nutrition. We're going to look at stress. We're going to look at sleep. I'll take them through then a personal training program after they graduate from PT. And we'll have this whole 360 view and to give them the team that I didn't have when I was going through recovery. And then I left the PT clinic a few years after that and now launched my third venture, Verdura Method, which is really giving everyone, no matter where you are, it's an online course. It's based on nutrition, but it does give that 360 view of the body where we look at your sleep and your stress and how you rest and what you eat and what your movement is during the day. So I'm excited to be here and, talk more about all of that. But that's what led me here today.
But what an awesome journey. I like you. I mean, I was from the time I was a teenager. Like, I love how the body works. This is so fascinating. I want to nerd out and learn more stuff. So I love hearing that because there is a place for modern medicine and there is a place for remembering that a pill can't undo terrible nutrition, sedentary lifestyle, poor sleep. It doesn't work that way. And so tell me about some of the patients that you've seen, because you're right, that space in between the PT and optimal function, I think some people kind of fall off there.
Oh, absolutely. A lot of it has to do, I think, with just going through something and then being like, okay, your insurance has run out. So I think there's an issue with the system, right? Like what's at play in our country. And also the education from whoever is in charge, whether it's a physical therapist or an orthopedic surgeon, an occupational therapist, they only know what they know. And so if we can get more teams together also to help you once you graduate, okay, this is what it's going to look like when you leave here. Let's get you on a plan for what the next 6 to 12 months are going to look like. Because I mean, that's also what we didn't even talk about yet is just the amount of medication that people are prescribed, right? And there is no blueprint to help people eventually get off this medication because that has its own side effects. And then people have to take now over-the-counter medication to offset the side effects of prescription medication. And I know when I went through it, there was no one that was like, we need to get you off of this eventually, and here's our plan to do it. And so if we could, eventually get to a place where everyone kind of works as a team in the health industry, and we give more blueprints for what is your 6 to 12 months going to look like after this, once you do graduate from occupational therapy, physical therapy, your surgery recovery, then I think people can be a lot more like confident in knowing like, okay, this is my plan and this is how I can take the next steps instead of just being like pushed out into the world and like, okay, you're done here. Bye.
Yeah, and I love that you brought like some of my favorite words, team. Every practitioner, every physician, every specialist doesn't have to specialize in absolutely everything, but knowing, okay, if this is what I specialize of these components, how can we partner with these? And that blueprint is really key. Coming out of an illness, coming out of an injury, coming out of a surgery, it takes time to heal, and optimizing all of the things. People just forget. It's so easy to take a pill instead of look at your diet or look at, yeah, how much time do you spend outside? How much time do you spend laughing? How is your sleep? All of those things. So how do you, if somebody finds you and they say, okay, this is great. I want this approach, and look at that. How does it look like? Give us that journey. And I know it's different for each person, of course.
Yes, exactly. The first thing is I ask a lot of questions, because I think we get into this idea that if someone in the wellness industry, if someone asks, oh, I don't sleep very well, or I'm not feeling very good, I have low energy, a lot of wellness practitioners will jump to, you need this supplement, or you should do this, as opposed to taking a step back and learning a lot more about that individual. I ask so many questions. I have a basic health questionnaire, But then I also ask things like, what's realistic for you? And what is the first thing you want to change? Like, what's the most important thing that you want to tackle in the next month? And then we go from there. And what does your schedule look like? So in my program, it's actually, I give journal prompts and I help, if you're not working with me specifically, if you want to do this course on your own, which I offer, I teach you the questions to ask yourself. What do I want to work on today? What makes the most sense for me? For example, I'm an early riser. I love waking up at 5 a.m. and having 2 to 2.5 hours before my kids wake up to get a bunch of stuff done. My idea of waking up early at 5 a.m. is not everybody's idea of waking up early. Okay. So I ask, if they say, I want to wake up earlier, then I ask, what is early to you? How much earlier do you need to wake up so that you don't feel rushed out of the house? And so it's more just making it really tailored to each individual and learning to ask yourself those kinds of questions like, what's the first thing I want to tackle? What is one step I can start today? And what is the most realistic for me that I can make it a sustainable change? Because if you try to overshoot, you will most likely end up not being able to meet that expectation and feel really bad about yourself.
Yeah, then people feel worse. It's like if they're on some super strict diet and they eat a piece of cake and they decide, oh, I'm a failure, I might as well eat the whole cake instead of
Yes.
saying, like, I had a piece of cake and I can continue. So, what I appreciate you and why we connected is realistic and
Mm,
sustainable. Because I
yes.
hate the fads. They drive me nuts. You can lose weight eating nothing but donuts. But is that healthy? No.
I say the same exact thing. There was a professor, I think he was in Missouri, and he did this study with his students. And he said, I am going to eat this many donuts or sorry, Twinkies a day, and I'm going to show you I can lose weight. Is that healthy? No. But when it comes to calories in, calories out, like, of course you can lose weight, but is that for longevity? Absolutely not.
And no, and it doesn't promote health. And so realistic and sustainable for some people, getting up early might look like 8 a.m. There's people who are just early risers, kind of late. And I love that you don't have a one size fits all approach because when I hear practitioners doing that, it makes me think that they're just not educated enough.
Mm.
Because the same in the future, I believe that we will have a lot more testing available. So we can tell you keto will work great for you, Mediterranean will work great for this person, all of those things. But what I admire is the lack of a one size fits all and the curiosity and the questions. That's how you get success.
Yeah, and I think what I saw on your website, I think why you and I are so similar in that way is because it comes from a deep understanding of empathy for another individual. Because you realize you've seen enough patients probably in your work knowing like they're never going to be able to do X, Y, and Z. So what is something that's more realistic? And if it's just a doctor that doesn't have that empathy, they're not going to be able to read the room to know it's an unrealistic ask of a patient.
Yeah, I was like, oh, I have my med students and they had just learned about healthy eating and stuff, and listening to them talk to one of my patients who was homeless about organic food, and I'm just in the corner like, oh my gosh, this is they're
Yeah.
eating garbage can food. It's not organic. You know your audience. What can this person do in their current circumstance to try and optimize? And it was just it's so fascinating to see people do that.
Yes, I'm with you.
Yeah. So well, let's talk about inflammation. I appreciate now that it's a lot more well understood just by the public than it used to be in the past. But it is a problem, and there are things that can be done about it. So, what are the downsides of inflammation?
So, inflammation comes in a couple different ways. Sometimes it comes from an outside source, like an injury. So, something happens to you, and now your body is having a response, and that response is shown through inflammation. So, one example of that would be spraining your ankle and a bunch of fluid rushing to your ankle, and your ankle swelling up with fluid to protect the joint. That's an idea of inflammation, right? That's called acute inflammation. We can also take inflammation by ingesting it, and that's through like processed foods, inflammatory foods. And that comes from, and then that goes into our digestive tract. And when that inflammation then stays in us, our whole body is working on a bunch of systems, right? We've got the cardiovascular system and the digestive system and the muscular system. So all these systems are at play. And when we're ingesting some of this inflammation, a lot of these systems can't really work the best that they're supposed to. So inflammation can come from things that we ingest. It can come from lotions. It can come from stress. I always tell clients that stress is invisible but manifests in physical ways. So that's kind of the same thing for inflammation. It's kind of invisible, but it manifests in our body in a physical way.
So what are some healthy, I mean, certainly some inflammation is necessary, right? It's how your body sends the inflammatory response to help heal your injury or your wound. So we don't
Right.
want all inflammation to go away, but we don't want unhealthy amounts of inflammation. So what are some realistic things that people can do to help?
Right. Going back to kind of knowing your place and like what's realistic for you. When I give advice, I always say, I want you to be able to know like some of this advice is for me and some I know maybe doesn't make sense for my life right now. And I always like to kind of give that as a caveat. But if we were looking, and also as a mom myself, like I'm a mom and I have a crazy schedule. Some days I'm really on top of it. And sometimes I'm like, I need to order in or eat out. And it's just not this time in my life right now where I can be on top of it. But if basic things that we can do to lower inflammation the easiest would be to swap processed drinks for water. Just start drinking more water. I am all about the water. And in the Midwest, there's a lot of different kinds of beverages. Yeah, right here. So, just sodas and juices, just making sure that you can get in. I always tell my clients shoot for 1 liter in the morning and 1 liter in the afternoon. And let's just focus on that. And so I would say bringing in more water, and that just helps you flush out your system. And then in addition, before I tell clients to cut things out, I ask clients to bring things in and a lot more color into their lives in the way of fruits and vegetables. So even if you lean more Mediterranean or more keto, they have the same thing in common, which is eating more vegetables. And so I always like to tell clients just try to diversify your diet, bring in as much color and kind of look at it as a challenge when you go to the grocery store or at a restaurant. Like, how much color can I put on my plate right now? And keep it really fun and interesting in that way, and like a very low stress, low expectation way.
Yeah, and I love kind of the healthy attitude because as soon as people hear that they are going to start getting healthier, they always go to the lack. What am I not going to get anymore? What is going to be taken away from me? And it doesn't have to be like that.
Right. And a lot of what I do is work on mindset around food, right? Because we are all holding on to these ideas that really were pushed on us from children. You have to finish your plate, but don't eat too much. That all already is so conflicting and so confusing. And then we hold on to that as adults and then we overeat, but then we're in this scarcity mindset around food and we want to overeat all the things that we don't necessarily get. And so if you naturally just start becoming more curious and think of more vegetables as fun, the reason why I named my program Verdura is because that's a Latin word for vegetable. I just felt like vegetables need a little reframe, like a little rebranding to make it a little bit more fun and interesting. And, if we just change the way our brain thinks about what we're doing, focusing on what can we bring in, like you said, and less about like what are we cutting out, the body will just naturally fall in line in a much more enthusiastic way.
Yeah, because you start to feel good when you're nourishing your body. My favorite lunch is I get a whole bunch of different vegetables, some purple cabbage, something green, throw in some onion, this. So the whole lunch is this super colorful thing and it looks pretty. And I know I'm not going to get this mid-afternoon slump because I've got
Right.
an avocado and a plate of just all the mixed veggies. And then I don't need the caffeine. I don't need the sugar to get through this part of the afternoon. And you feel good. And then that starts to help reinforce the message.
Absolutely. I always say you do the physical actions first, and then eventually the brain just takes over, and then you start going places, and you're like, the brain just kind of computes it for you. The brain will tell you, like, I actually don't want that anymore. I want this. This makes me feel good. And then you don't have to try so hard.
Yeah, and it takes away a lot of the stress of that. I think people think that the motivation is going to come first and the action is going to come after. And I don't know whoever started that wrong message, but I'm always so much more motivated after I've exercised. Some days
Oh, yeah.
when I'm getting started, I'm not that excited.
Oh, yeah. I'm not like, yay, I get to wake up at 5 a.m. tomorrow. But, after I wake up and it's 7:30 and I'm like, wow, I've gotten so much accomplished. And then my kids wake up and they're being crazy. And I actually feel okay handling this situation because I was able to get X, Y, and Z done in the morning before. But I'm not, I would love to lay in my cozy bed all day. Why not?
Oh, of course. And that reframe that the motivation comes after, or you get then after I exercise and I feel great, I'm like, oh yeah, my brain makes that association and it kind of snowballs.
Right. I say something to my clients a lot, the difference between self-care versus self-soothe. Self-soothe is this idea where it's easy in the moment. It makes you feel really good in the moment, and you don't have to try that hard to do it. So if we were to take this idea of sleeping in, right, that's self-soothing. In the moment, it feels good. It's something easy. I can just not do the harder thing, which is wake up. and it makes me just feel good in that particular moment. Self-care is something that's harder. It might take a little longer to do, but the lasting effects can give you a high for the next 24 to 48 hours. So even though I wake up at 5 and I have to get out of bed and I'm cold and I'm tired and I don't really want to do it, I feel once I've accomplished that and got everything done at that early hour, I now am on this high for the next 24 to 48 hours because I feel accomplished from it. So I always ask my clients, like, are you acting in these, is this an activity that's going to self-soothe or self-care? And, it's just changing one or the other in the moment. No, it's going to be hard in that moment, but later on, you're going to feel better for it.
Yeah, and even having a ratio, it's not saying that we never get to have a self-soothing moment,
Right.
that there's perfection all the time. But if your ratio is 90% self-soothing behaviors to 10% self-care, overall, you're not going to feel good. You're not going to be at that healthy, optimal energetic. And so just transitioning toward that. It's like getting in an ice bath. I know the health benefits down to the cellular mitochondrial level, but I tell you what, when I'm first stepping in, it does not feel good. About a minute and a half into it, when I'm probably saying some words I can't say on my podcast. And then if the good finally hits, and then you feel good afterwards. So not everything feels comfortable in the moment, but that long benefit is lovely.
Yes, absolutely.
Oh my goodness. So what are some core principles? So you've talked about water, you talked about vegetables. Actually, I want to go back to vegetables because I'm going to just straight up confess here. I had this identity as a picky eater as a kid. I hated vegetables. If I ate 3 servings of vegetables in my entire childhood that wasn't a baby carrot, I'd be shocked. And those 3 were all probably canned green beans. And I don't know why they have the audacity to call them green beans, because if you've ever seen them from a can, they're more of like a grayish color. Disgusting. And so I had to start navigating eating vegetables as an adult, not liking any of those things. And so I had to get pretty creative, and I figured it's better to have broccoli smothered in ranch than no broccoli until I could transition my taste buds. What suggestions do you have for people who say, I hate vegetables, or I'm a picky eater? Now I'm having a plate full of vegetables every day and feel delighted about it, but my 9-year-old self would have been horrified. So how can people
Yeah.
earlier on in that journey just start it?
I love this question. This is my specialty. This is what I do. The first thing really ends up being mindset. And the narrative that we speak out loud to others and in our head end up solidifying all of our beliefs. So if you continue saying, I am a picky eater and I don't like vegetables, then you will be a picky eater and you will not like vegetables. So that is the first thing, is that with my clients, I always say, like, you need to start changing your narrative immediately, because if you do want to be healthy, or if that is anywhere in what you're feeling right now, because their narrative may also be like, I don't even really want to be healthy, it's too hard. You have to start changing the way you're thinking and speaking. So starting to say things like, I'm not the same person that I used to be. I can do hard things. I'm interested in trying things that I never tried before. And then also knowing that taste buds evolve over time, that what you liked as a child is going to be different than what you like as an adult, and knowing it can take up to 70 times tasting something for you to adapt to it, which is what I always tell myself when I'm attempting to feed my children and they throw it on the floor. So it really starts with mindset, belief in yourself, creating a narrative that is more positive towards what you're working towards, and then also knowing that scientifically, it's also okay when my clients try a recipe and they're like, oh, I didn't really like it. I'm like, I'm not offended. I didn't create this food. Like, everyone's tastes are different. You can tell me that you didn't like it and we could try something else. It's going to take time for your taste buds to change and evolve. And just like you said, start with, get some tempura vegetables, get some vegetables with some sauce on it, like put it in butter. I don't really care. But the more you are exposing yourself to the textures and your brain just seeing it on the plate, that alone is going to open your mind up, as long as you are making sure that you have a positive narrative attached to it. Like, I'm really good at trying new things. I'm not the same person that I used to be. I bet if I keep doing this, I am going to end up liking a lot of different vegetables.
And it did work. It absolutely did work. It's hilarious. I still don't love green beans. I try them, but all other vegetables, and I'm like, oh, let me try that. Let me do that. And I did the same thing with salmon. I didn't care for seafood. That was another one of my picky eater things as a kid. They're like, okay, well, let me hose it down with mustard, and some spices, and try and cover up some of the flavor. And now, I can eat a plain salmon with nothing on it. So I like people to hear that message. You start where you start. But yeah, it's almost like I talk to people, I call it the name tag effect. Those old sticky, hello, my name is name tags that people with long hair, immediately eat your name tag. But I had to let go of calling myself a picky eater.
Yeah, and it's not just what you call yourself, but I've learned a lot from my clients that it's also what their parents attach to them. So many parents and family members or friends attach narratives to us as children, and then we go into adulthood thinking that about ourselves. Like I had a client say to me, I don't like vegetables. And then we start, working together. I'm like, why do you keep saying you don't like vegetables? You actually eat a lot. And he goes, I don't know. My mom always told me I'm a picky eater and I don't like vegetables. She attached that narrative to him, and he is now a 45-year-old man. And I am the first one to be like, dude, you're not a picky eater. You actually like vegetables. And this was the first he realized it. And he called his mom after it. He's like, Mom, guess what? I'm not a picky eater. So it's paying attention to not just the narratives we put on ourselves, but also that people in our lives have put on us for us.
Oh, yeah. Those name tags are everywhere. Some of them have been kind of implicit messages we get from society. Some of them have been very explicit, like, you're a picky eater. I hate taking you out to restaurants. I'm not paying $20 for your dinner, and all you're going to eat is a piece of cornbread. So,
Yes,
yes, being mindful of that was really the keystone for me changing.
totally. And I think you had that inner confidence that you could do anything. Obviously, you get to a place of success when you have that confidence. So I'm not surprised that you were able to push yourself out of it. And I think that people need more of that confidence, knowing like I could do something different. I could try new things. I can evolve from who I used to be.
Absolutely. There's so much possibility. And I hear people, oh, it's too late. I mean, there are people that start running marathons in their 50s or 60s. Not suggesting everyone needs to do that because that's actually not my dream either. But it's never too late. Whitney Jones, who I did a podcast with not that long ago, she's broken so many bones. She started becoming a competitive, like Miss Fitness Olympia in her 30s. She didn't spend her whole childhood doing gymnastics. And she
Right.
just has the audacity to be like, let me try it. And, you have to have be a little bit crazy. And she just did it because you believe that you can. So this whole, it's too late, or I'm too sedentary, or I'm too fat, or I don't exercise, it's all mindset.
Yep, it's your narrative.
Yeah. That is so fascinating. And so when people work with you directly, you actually get to kind of help walk them through. And because I mean, for this guy to not even be aware that he's saying
Yeah.
this as he's eating vegetables, it's funny. And it's not a lack of intelligence. Our stories are so deep, we forget.
Absolutely. Yeah. I mean, I was shocked, I mean, I loved it. I love when I brought that up and, his life has changed now just because we worked through that one thing.
Yes. And now you said something fascinating because a lot of people, they like, oh, I want to keep my clients forever and I want to do this. And you said something very fascinating to me is that your whole kind of goal is to put yourself out of business. To just so that people don't need you. And what a counterintuitive thing to say. What do you mean by that?
I feel like I'm doing a good job if my clients never have to talk to me again. Obviously, everyone is always going to have questions and they're not professionals in this field. So I welcome them always reaching back out and working towards things. And we're all humans. I always tell them, we're not robots. We're never going to get this perfectly. But if my clients who, let's say they like were binge eaters, for example, and then I never hear from them again about binge eating, like great. They know they've worked through that and we never have to talk about it again, then I've done my job. And if they are so okay on their own and maybe they just reach out with a question or two or kind of just follow along and then that makes me happy. My goal is to really never hear from my clients again because they are in such a good, happy place. And that to me is the most fulfilling part of my job.
And that is so cool because a lot of programs are like, I want you to be in this for the next 500 years. And that's just so intimidating. But you're giving them the wings, you're giving them the tools for realistic and sustainable. That is just incredible.
Yes, that's the goal.
Yes, no, I love it. So right now, people are overwhelmed, right? Ooh, it's everywhere. So if they're looking at their journey and they're like, gosh, I just have 97 things about myself I need to change. So a little bit of that kind of self-deprecating narrative. How do you start?
Yes. I have a client right now who I've been working with for a bit, and she even said to me, I was in a state of freeze because I was so confused about where to start that I just haven't started anything. And she heard me on a different podcast and reached out to me, which honestly is the first step is, maybe reaching out to a professional and having a guide in it because it is very confusing. In life coaching, they give you this wheel and it breaks the wheel up into kind of like pizza slices. And it's like, career and social life and health and finances. So I would kind of take that wheel, and what you want to do is rate everything 1 to 10, and you pick one thing that you feel like you want to work on today. Circle it, and maybe we're in health, and we realize your health is maybe like a 4 out of a 10. Okay, well, what is one thing that would bring that 4 up to a 5 today? And so maybe that's, getting in more water. Maybe that's picking one new recipe a week. Maybe that's just trying one new vegetable a week because you don't really eat many vegetables. So it's really just taking, kind of rating where you're at in certain things, 1 to 10. And it's not making it, a 4 to a 10, but let's keep moving it up one notch at a time. And what's one thing you can focus on today? And just giving yourself grace. I say over and over again to my clients, we are not robots. So why are we expecting ourselves to act like robots? There is going to be a flow to our days, and depending on the sleep we got, the stress we're under, the amount that's on our schedule, it is going to ebb and flow on a day-to-day basis, and to really be realistic. And when you have a day where you're feeling a little bit more up, be like, I'm feeling more up today. I'm going to move that 4 to a 5 today. What's one thing I can do? Don't do it when your day is, a 2 out of a 10. Don't attempt it on that day. So it's just being realistic about what makes the most sense in that moment on that day.
And that's so helpful because it gets you out of overwhelm. I've had this before where you have so many things to do, you just don't even start because there's too many things to do. And you take it and break it down into, you don't have to go from a 2 to a 10, a 4 to a 10, because that's what scares people. Like they see that 10 and they're like, I can't get there today. I'm going to do nothing. And you make that process so much easier. All right. I mean, I think that this has been great. I mean, just kind of going back before we finish up to your car crash. I mean, you were hit by a car. When people say car crash, they think you were in a car with some airbags and some seatbelts. You were a pedestrian hit by a car with no safety equipment. And I know we talked about the physical trauma, right? We see that in the ER in terms of sprains and bruises and fractures and things like that. But there had to be some emotional trauma along with that.
Oh yeah, that took a long time to work through. It's been 14 years now, so it's definitely I've been able to work through it a lot. The first 2 years were the physical recovery, where I was really focused on, I broke my femur, broke my hip, broke my arm, broke my nose. So like head to toe, it was a lot of breaking. And I still to this day have titanium rods and nails in my body. And the true physical recovery to just get back to somewhat of normalcy was a couple of years. And I had to have some follow-up surgeries as well, aside from like the initial emergency room surgeries. The emotional trauma from that was, well, dealing with just walking across the street. Like, I'm never going to not cross the street again, but that took a long time to not have that level of anxiety. That took years. And just once you go through kind of a trauma like that, you see everything as an accident. The worst case scenario. I call myself an intrusive thought queen. Like I see every bad thing about to happen, which I'm working on, but once you go through something like that, you realize, wow, anything can change in an instant. I have to do my own narrative work. I have to do my own inner coaching for myself to work through a lot of things. And I've had to do that over the years, and it takes a very long time. The longer the time goes by, it gets easier for sure, but it was the emotion around it. I definitely hit some rock bottoms. I was not in a good place mentally. I'm on a lot of medication, which was messing with my mind and just my mood swings, trying to get off these prescription medications and all the other. So when your body and your brain doesn't feel really good, you're isolating yourself. I mean, I went through a lot of ups and downs with that, a lot of downs in the beginning, and then it slowly kind of started getting better. a lot better when I really found my purpose through the accident and helping other people. And I find, with my clients, I'm always asking them for the same reason, like, what are your hobbies? What bring you joy? What makes you smile? Because when we lose that sense of purpose and we're feeling so down emotionally for any sort of trauma that can happen in our life, whether it's financial trauma or, a death of a loved one or a divorce, whatever it is, it could bring us to such a dark place that we have to at some point pull ourselves out of it in any way we can, which is almost like coaching ourselves through it.
And I always appreciate that. For somebody with your level of expertise and health, I mean, look at you, you're just glowing with health to share that you have had some dark times, that there were times where you had doubts and you weren't always doing all of the exact right things. Because when somebody is too perfect, you're like, how can I even ever get there? It's too much. And I am grateful that you share that you have gone through actual struggle. I mean, that is real struggle. Femur fractures, these things are no joke. That is a real struggle, and that the physical recovery takes time, the meds, and then but the emotional and the mental that you had to go through, because it gives other people hope. Like, people go through some gnarly stuff, and that it is possible to get to this light at the end of the tunnel where you're just loving your life most of the time. Nothing, we're not robots.
Right. That's why I feel very strongly about the holistic aspect of healing because I was on so much medication that the medication that's prescribed it's so dangerous that it's really just given out so easily and how much it affects our mood and the way we function. And that scares me for people that don't have any background in wellness or how the body works to be able to know how to get themselves out of it. And I can tell you, I was in a very dark place. Had to move back home with my parents at 27 years old, and they were bringing me food every day, and I had a wheelchair, and they would just bring me my food to the bed, and I was just in such a dark place and in a bad mood and being mean to everyone and snapping at everyone because I was just so depressed with my life situation. And one day my mom came into the room and she said to me, I'm not bringing you your meals anymore. There are people that are in worse situation than you, and they are getting up and they are in the gym and they are trying and they're getting their strength back. If you want to eat any food, you have to get in your wheelchair, wheel yourself down to the stairs, scoot yourself down the stairs yourself, get in your walker and come sit at the table with your father and I. And that was sort of like the wake up. Not that I felt good about it in the moment. I wasn't like,
Oh, sure.
oh, thanks, mom. I feel great now. But so she definitely had to snap me out of it a little bit. And I share that to give an idea of like how depressed I was from it. Like it wasn't like this easy thing, like, oh, I did some physical therapy and ate well and now I feel good. No, it was dark for years. And I had to have some people in my life support me, but also give me that tough love to say, like, if you want to change your life, no one is going to do it for you. You have to make that decision for yourself, which comes back to the narrative of what we tell ourselves, believing that we can, believing in ourselves, and then just one thing a day. What is one thing that we can start changing one at a time?
Oh my gosh, that is so inspirational. I know that there are people who are listening who are in all kinds of different places right now, but you start where you start. It's, it's one step, it's the mindset. You don't have to get to the finish line all in one day. You just keep going. I love that so much. Lisa, where can people find you? Because I know that there are people who are listening who are like, this is exactly what I needed to hear right now, and I need to hear more. What's the best place for people to get a hold of you?
So you can come to my website at verduramethod.com. You can come to me on social media. It's Lisa Schultz, and I'm pretty responsive to both of those. So on my website, it'll link you to my email, which will give you a submission form to talk to me directly, or you can go to send me a DM on Instagram. And on Instagram, I'm posting all the things I do on a daily basis and how I keep it real. And some days I'm doing great, and some days, I'm kind of getting by eating whatever is in front of me.
Honesty. Those are the people that I trust the most. But truly, I mean, you really have expertise. You really understand human behavior change, body physiology, and all those things. And that's why I was so excited to bring you on and share you with our audience and with the world. So, Lisa, thank you so much again for being here today.
Thank you so much for having me. This was lovely.
All right. Thank you for listening to this episode. Lisa Schultz's journey through recovery highlighted the gaps in healthcare, particularly what happens after leaving the hospital. Too often, patients leave a healthcare setting without a clear roadmap for what comes next. This leads to confusion, missed care, and even preventable complications. That's why we created the HOPE Discharge Safety Protocol, a step-by-step checklist to help you safely transition from a hospital or healthcare setting to home. Download it today. You'll find it in the show notes so you can take control of your recovery and ensure you have the guidance you need for a smooth healing process. Now let's get those top 5 key takeaways from Lisa Schultz. Number 1, the system often leaves patients without a clear plan, but you can take control. Lisa saw firsthand how many people fall through the cracks after medical treatment. Whether it's recovering from a surgery, an injury, or an illness, having a post-care plan is essential. Don't rely solely on what's provided. Advocate for yourself and ensure you have a structured approach to your recovery. Number 2, healing requires a 360-degree approach, not just medication. Recovery isn't about taking the right pills or doing just physical therapy. Lisa's Verdura Method focuses on all the things such as nutrition, stress management, sleep, and movement as key elements in the healing process. A well-rounded approach improves recovery outcomes and long-term health. Number 3, graduating from physical therapy or treatment doesn't mean you have fully healed. Just because your insurance stops covering therapy or your doctor says you're good to go, it doesn't mean you're truly back to full function. Many people are discharged and don't have clear guidance on what comes next. Again, a structured plan like the HOPE Discharge Safety Protocol can help bridge that gap. Number 4, the words we tell ourselves shape our health and recovery. Lisa emphasizes the importance of changing your personal narrative. If you have small steps you can take daily to move forward. And number 5, your support system matters. Build a team that helps you thrive, whether it's healthcare providers, family, or professionals like Lisa. Having the right support can make all the difference. Seek out people who understand your goal. Take the next step in safeguarding your health by downloading the Discharge Safety Protocol to ensure your safe transition. Keep on advocating for your health, keep building your strength, and keep on navigating with hope.
Thank you for tuning into Navigating Hope with me, Dr. Jaime Hope. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com.